Today, we see Pilates as some kind of trendy, expensive workout that is done by people who want to look cool or by celebrities. But the reality is, Pilates actually started out as a serious rehabilitation exercise for soldiers who were injured in World War One. In this video, I'm going to be talking about why Pilates is not just a trend, but actually a clinically useful exercise approach that a lot of people with different types of diseases should consider trying. And by the end of this video, we'll know what Pilates was actually built for and how it ultimately morphed into this status symbol, but also how you can use it for real health breakthroughs. It was created by a man known as Joseph Pilates in the early 20th century, and he originally called it Contrology, which essentially meant coordinating your movements with your mind and coordinating with your breath in order to align your body properly. So no, Pilates wasn't born in some trendy LA studio. It began in rehab and training rooms. And so early adopters of Pilates were often injured soldiers or performers and dancers who needed precise control over their bodies and ways to recover from injury easier. They loved it because the exercises emphasized strength with control as well as gentle rehabilitation in a more mindful way. So, how then did Pilates go from rehab tool to lifestyle status symbol? Well, over the decades, Pilates migrated out of the hospitals into dance studios and high end gyms. Joseph Pilates invented an apparatus like what we know today as the reformer. But instead, he called his the Wonder Chair. And this machine was meant to help people practice Pilates a lot more easier. Where it's a super bulky, super expensive piece of machinery, which meant that Pilates started requiring specialty studios. And this created a little bit of an exclusivity factor because not everybody could access a reformer in their homes. And then soon after this came all the celebrity endorsements from movie stars, models, athletes. Everybody started swearing by Pilates for these long, lean muscles and injury rehabs that they were able to do. Fortunately, when celebrities and high profile people jump onto a trend, it tends to start making that trend a lot more aspirational. And so Pilates left from this exercise that has insane health benefits to a status symbol that is. And so unfortunately, all this visual appeal has overshadowed the clinical benefits of Pilates. So today I'll go through a few specific use cases, and for each I'll cover three things that Pilates can help with the most. Let's start with chronic low back pain. If you struggle with a persistent lower back pain, Pilates might be more than just a core workout for you because it can actually help in reducing your back pain and improve how you move through daily life. Typically, Pilates for back pain is done on a mat or a reformer, and you have to go in or do it about 2 or 3 times a week. The exercises that you should do should focus more on strengthening your core and back muscles and teaching you how to move with a more stable, aligned spine. During your class, you hear a lot about engaging the abs and leaning into a proper hip hinge. During the exercise itself, you have to watch out for if you have any sort of sharp pain or any other red flag symptoms like a shooting pain down your leg. Another thing Pilates will teach you is to respect your pain and to sort of be in one with the pain. And so whenever you feel pain, even during the exercise, that should be your goal, to not push it and to stop right there. Another shocking disease area where studies have proven Pilates to be very helpful is Parkinson's. And that's because Parkinson's affects movement, balance, and coordination. And so far, it appears Pilates can improve balance and postural control and even help with smaller movements like walking. So for someone with Parkinson's, maintaining stability and posture is the most important thing. And Pilates focuses on core strength and mind and body connection. Usually for people with Parkinson's, you don't need a reformer. You can perform Pilates on a mat, on the floor. And what you're focusing on in the initial stages is really just pace. The pace for these patients is typically slower and the tempo is very deliberate. You don't need to do Pilates 3 to 4 times a week if you have Parkinson's. You may have to do this once or twice a week, and there are, of course, special considerations that you would have to put in place for somebody who has Parkinson's because they may suffer from things like freezing episodes, which is when they monetarily can start or continue a movement. Also, Parkinson's medications and the condition itself can cause blood pressure changes, orthostatic hypotension, which is really just a fancy term for feeling dizzy when you stand up. And so because of this, typical transitions during Pilates, like going from lying down to standing up, have to be done a lot more slowly and carefully. Finally, a third use case for Pilates is for stroke rehabilitation. After a stroke, people always have weakness in their core and on the side of their body that was affected by the stroke. And so balancing can be hard. If you're this type of a patient, you would want to start with very task specific sequencing, which means that you have to practice the same movements over and over again. And these are typically movements that can help you with your activities of daily living, like waking up from a bed or walking to the restroom. Sometimes, instead of getting a Pilates instructor, you may want to get a caregiver that would just specialize in that. Because with stroke victims, that repetitiveness of these motions is what is more important than trying out different positions that don't really affect their lives. Also, thanks to technology, there are now tele-Pilates sessions for new stroke victims as well, which means that an instructor or therapist can guide a patient from home. You can also go on YouTube and watch videos that are available on there for free. Also, with patients that are suffering from a stroke, the most important thing to also monitor for is to just make sure that you are working with the medications that they give them. After a stroke, muscles can be either really floppy or super stiff. And so the movements that you make during your Pilates session may need to be adjusted to handle that. And as always, monitor for medical limits like where you start feeling lightheaded due to low blood pressure. This last one is still under research, but there is a lot of evidence as well that shows that Pilates can help a lot of women recovering from breast cancer. And the reason for that is during breast cancer treatment and surgery, many women deal with issues like fatigue and also just overall a weaker upper body function. And so Pilates has been shown to gently bridge back these normal activity cycles and helping the patients just get back to their lives. But this requires a more specialized program. So you need to enroll in a program whereby you get Pilates for breast cancer recovery. And the reason for that is one important component of breast cancer recovery Pilates is lymph awareness. Some breast cancer survivors are at risk for lymphedema, which is swelling that occurs in the arm due to a lymph node issue. And so a specialized instructor that is trained in this area will avoid overworking your arms or doing motions that may aggravate the swelling. Everything we've mentioned is important, but I would say for me, the most critical use case for Pilates for improving healthcare is when dealing with osteoporosis and low bone density. Pilates is often recommended for people with low bone density, and this specifically means older adult or postmenopausal women, as it is a safer way for them to exercise. Popular exercises like running or skiing really does a lot of damage to joints and bones. And so Pilates is a lot gentler on the body, especially for these women who are undergoing hormonal changes and require a lot more extra support with keeping their bones in place. A big emphasis during a program for osteoporosis is keeping the spine neutral. And so you'll tend to do a lot of standing and balancing exercises, which includes things like standing on one leg or gentle toe raises, which may be mixed in with the Pilates routine. The key goal here is to not do a lot of exercises that require you to bend over or bend forward. Now that we've seen a few use cases of Pilates, we can understand why it is such an important exercise for clinical results. And that's because Pilates needs to be tailored to a specific problem. Now, when you bring together a group of 20, 30 people that have different problems or different needs, that's where the divide starts coming in. So if you decide to pick up this hobby, really make sure that you understand what your needs are and what you're trying to get out of going to Pilates, and find an instructor that is uniquely suited to those needs. Always remember that you do not really need fancy equipment for Pilates. You must not always do Pilates on a reformer. Mat Pilates is incredibly effective and it is a lot more accessible to everyone. It doesn't mean reformer Pilates are bad. Reformer Pilates are good, but the only difference is they provide immediate feedback. For example, your reformer straps and springs can guide your limbs and let you know if you're within balance or out of balance. But if you don't have a reformer and if you don't have hundreds of dollars to pay a month for an instructor, just look for a YouTube video or enroll into a program that is suited for your needs and begin your workout. The most important thing to take away from this video is you need to find the right instructor for your specific medical needs or your condition, or if you're just doing Pilates for the sake of it, you need to get into it with a very specific goal in mind. Pilates really is for everyone of all ages, and I'll even say older people need this more. It's also for people of all shapes and sizes. And so if you ever feel like a class or an instructor is not being inclusive, and maybe they're only paying attention to people that are only of a certain fitness degree, then just find somewhere else to go or do it at home by yourself. Stay healthy, and I'll see you in the next video.